Hi, a very good evening, each and every one of you. So, when I asked you how you were, I see some of you answering very stressed. I do understand. I completely understand your current scenario. Obviously, you might be perceiving high levels of stress. But let me tell you one thing very frankly, if there is a problem, there is always a solution. And these stress related problems, the solution almost always lies within us. Someone said it's easier to say all these things, but let me start with this. It's easier to follow these as well. You know, think positive. It's easy to say. Thinking positive, it's easy to do as well because luckily our brain has a capacity to inculcate and incorporate only one feeling, one type or nature of feeling, that is either positivity or negativity. Both cannot coexist. Can you be happy and sad at the same time? Obviously, no. Can you be positive and negative at the same time? Obviously, no. So there is only one side which our mind takes it up, depending upon the inputs which we feed. If you're feeling stressful, if you're worried, the feelings persist, the feelings continue. If you're happy, if you're confident, if you're enjoying your preparation, if you're hoping for the best, the same thing perpetuates. So just think of it. I know I do understand your feelings and I know how challenging it must be to each and every one of you, especially under these extraordinary circumstances. But always remember, if there are problems, there are solutions as well. And to problems of this nature, the solution almost always lies in here. Okay? So you said you're feeling stressful. So I hope this session, to some extent, maybe 0.0001% will help you reduce those stress levels, extrinsic factors. Okay? I hope you guys are ready, and please confirm the streaming quality and also the audio. If you have any issues, please let me know. Okay? So I'll be keeping a tab on the comments as well. Any issues with audio video streaming, please let me know. And let's proceed with our quiz. I hope you guys are all ready. Right. So in the process of this quiz session, also I'll be reviewing some literature which I have collected for your benefit, and I hope it really helps you out. So let's have fun. At the same time, let's learn something from this particular session. So once again, a very good evening, each and every one of you. Right. So before we start, I want you all to smile. Okay. Look at the camera and then please smile. Even if I can't see you, I can feel you. Okay. Really. Okay. So here we go. As I said, we'll have quiz in this particular session. So we have 3 rounds. We'll have a combination of image-based questions, text-based questions, and general knowledge questions. Okay. So first and foremost, we'll start with image-based questions. For each question, I'll give you some time, 1 minute or 2 minutes, 1 to 2 minutes. And then after you answer, I'll try reviewing relevant literature related to that question. I hope you guys are ready. So first and foremost, identify the personality which is being projected on screen. So who is this gentleman? Okay, thank you. Thank you, Vaishnavi, for the feedback. All fine. Okay, then we can proceed uninterrupted. So identify this personality. Who do you think this gentleman is? Please don't ask me for options, okay? Okay, if you want options, I can give you options. Ankur, Chetna, Amruta, Naveen. So these are the 4 options we have. So which one would you choose? Yeah, please, definitely take some time. I'll give you some time, but make sure you're giving me the right answer. Yeah, identify the personality. I gave you 4 options, okay? So you can't blame me, and you can't say that I've given you an incomplete question. So identify this personality. Okay, let me give you some information about this gentleman, and I'm sure you'll be able to answer in the process. So this is only for fun. Okay, it doesn't mean that you'll get these kind of questions in exam. So this is for knowledge, information, and fun. Okay. The primary purpose of all professions is to nurture and refine hidden, undiscovered talents. And I request you to please look into the image while I go through this literature. The primary purpose of all professions is to nurture and refine hidden, undiscovered talents. Dr. Greene Wardiman Black, G.V. Black, who is considered as father of operative dentistry, was born in a farm near Winchester, Illinois, USA, to William and Mary Black on August 3rd, 1836. In childhood, he never took interest in studies, rather developed interest in wildlife and nature. Instead of going to school, he preferred hunting, fishing, and roaming the woods. Studying plants and animals like wild turkeys, pigeons, deer, skunks, wolves, bears, foxes were more fascinating to him. Little boy Black seemed to be suffering from the same problem that Charles Darwin, Thomas Edison had in their boyhood. He could learn more in the woods in an hour than in school in a week, once he said. People considered him dull, idiot, and good for nothing. Let me repeat. People considered him, people, like when you look for external validation, this is what often happens. People considered him dull, idiot, and good for nothing. At that time, his mother was the only one who understood him. Moms are really great, right? Why waste time on school and work when there are more interesting things to do? He must have thought. He wandered in the forest, trying to learn himself, experimenting and exploring nature. This not only developed his sharp sense of observation and an analytical mind, but also laid the foundation of his lifetime achievements, which we are going to see very soon. I mean, in the next aspect of this present video. He had only 22 months of formal schooling, yet keen to grab every golden opportunity to learn in his own way. Mr. Black was primarily self-taught. He earned the title the father of modern dentistry. Some often even consider him as father of modern dentistry. And it goes on and on and on. And let me just list out the achievements of Dr. Black. In 1870, he invented cord-driven foot engine with a foot motor used till late 19th by most of the dentists. So a cord-driven foot engine. In 1871, he patented for an improvement in dental drills and an improvement in universal joints. In 1877, he reissued patent for his dental drill. He was reissued. And in 1883, he prepared his first book, The Formation of Poisons by Microorganisms. And in 1890, he published first edition of his dental anatomy, followed by phenomenal books, namely Operative Dentistry, 2 volumes, The Periosteum and Peridental Membrane, Special Dental Pathology. In 1891, he standardized the rules of cavity preparation and filling. In 1896, he standardized the formula of amalgam. With his knowledge of material science, he had been used almost unchanged till date. And in 1896, he proposed classification of dental caries and standardized dental terminologies. And he's credited with the first acceptable nomenclature for and classification of hand instruments, which we are all familiar with. And he has been awarded Miller Prize, Doctor of Medicine, Doctor of Science, Doctor of Law, Fellowship Medal, and it goes on and on and on. So some of the life achievements of Dr. Greene Wardiman Black. Okay, so you can find this picture in Wikipedia, and also we have an exclusive article in one of the PubMed Index journals on Dr. G.V. Black. Okay, so identify the personality. Many of you answered different answers, but it's okay, right? You can check out the article and you can check out his page in Wikipedia. Dr. Greene Wardiman Black, G.V. Black. Okay, now let's move on to our second question. Identify the instrument. So, in honor of Dr. Greene Wardiman Black, was given us the classification and nomenclature for instruments. Let's proceed to identification of this instrument. So identify the instrument which is being projected on screen. Okay, yeah. So is it plastic filling instrument, a hatchet, enamel hatchet? So which instrument is this? A chisel? Very good. So this, exactly. So as you can see, it's a stainless steel instrument where the working portion has been highlighted, and it is having a bevel towards one side if you closely observe, right? You can see it's a bevel instrument obviously used for cutting. So what instrument, what hand instrument could that be? It's a type of chisel. I can give you that hint. It's a type of chisel, and very good. So it is enamel hatchet. So what's the instrument formula for enamel hatchet? So you can answer in the meantime, and I'll review some literature. In the meantime, chisels, which are intended primarily for cutting enamel, can be grouped as straight, slightly curved, benangle. Also, we have another categorization that is enamel hatchets, and another categorization that is gingival marginal trimmers. All of these form chisels. So the instrument formula for enamel hatchet is 10, 7, 14. There can be variations, but let's follow the ones given in literature. Start there. So 10, 7, 14. Okay, so that's the instrument formula for enamel hatchet. So the enamel hatchet is a chisel similar in design to ordinary hatchet, except that the blade is larger, heavier, and beveled only on one side, as you can see in the image being projected right now. It has its cutting edges in a plane that is parallel with long axis of the handle, and it is used for cutting enamel and comes as right and left types for use on opposite sides of preparation. So some information given in Sturgeon. Okay, yeah, 10, 7, 14. Oh, very good. So instrument formula, try to memorize all of them. Also in e-classes, we have provided you the list of all the instrument formula of various hand instruments. Okay, so this enamel hatchet is a type of chisel. You might have seen a chisel, carpenter work. You might have seen several chisels. So this is a type of chisel. Very good. Now let's move on to our next question. Third question in first round, the one which I'm sure you're all familiar with. So identify this personality. So who do you think he is? I think we already discussed this question a number of times previously, and I'm glad you guys are able to answer. Okay, so he is a French physician who is considered as father of modern dentistry, Dr. Pierre Faucher. So in fact, we have an exclusive article in Pierre Faucher Academy website where they have clearly mentioned that way back in 1728, that is 18th century, Dr. Pierre Faucher, who was widely acknowledged as the father of modern dentistry, published Le Chirurgien Dentiste, which contained detailed information about all aspects of contemporary dentistry. It was his lead that encouraged others. And for example, before the end of the century in England, the distinguished surgeon John Hunter had published his book entitled The Natural History of Human Teeth. And the first course of dental lectures was established at Guy's Hospital way back in London. Okay, so some brief information about Dr. Pierre Faucher. Very good. So this gentleman is Dr. Pierre Faucher. Now let's move on to our next question. Yeah, Mr. Pierre Faucher, Dr. Pierre Faucher, respected Pierre Faucher. Fourth question, identify the instrument. You can see a stainless steel hand instrument where the working portion seems to be curved, and also there seems to be a bevel. So identify this hand instrument. Okay, they all look the same, right? Because mostly they were portraits, paintings, so they all look the same. So identify the instrument which is being projected now. Wow, someone said mesial GMT. Very, very impressive. There is a way to identify mesial and distal GMTs. I'm really glad that one of you could identify the side of GMT as well. So these gingival marginal tremors, again, these are type of chisels as we have discussed previously. You are absolutely right. This particular instrument is GMT. Okay, yeah, mesial GMT. So the instrument formula again is very important. So can anyone give the instrument formula of mesial as well as distal GMT? And in the meantime, I'll review some literature. So this GMT is designed to eliminate unsupported enamel on gingival walls of proximal portions, which I'm sure you guys will be using while doing class 2 cavity. It is similar in design to enamel hatchet, except that the blade is curved. Please look into the image as we go through the literature. The blade is curved and the primary cutting edge is at an angle other than perpendicular to axis of the blade. These features can be used to distinguish GMT from enamel hatchet. I will repeat. It is similar in design to enamel hatchet, except the blade is curved and the primary cutting edge is at an angle to the axis of the blade. The gingival marginal trimmer may be designed to afford access to mesial or distal gingival walls. And the second number in the instrument formula can vary, right? In case of distal, it is 90 to 100. In case of mesial, it is 75 to 85. Okay, just keep a tab on these values. Okay, so consider this very, very important. Okay, and the instrument formula is followed of 75 or 100, depending upon whether it's mesial or distal, 714. Okay, so we can find out the list of various instruments and their respective instrument formulae in conservative dentistry section of e-classes, right? Very good, very well answered. Now, let's move on to our second round, text-based questions. I really wish we had some music, but it's okay. Yeah, the second round, text-based questions. Here is the first question. Choose the odd one out. ADA, FDO, ISO, FDA. So choose the odd one out. I mean, I'm not talking about the apples. Obviously, it's the red apple, which is odd one out. I'm talking about the options. So choose the odd one out. Okay, so you think it's FDO. So what is ADA? American Dental Association, which we are very much familiar with. American Dental Association, ADA, Indian Dental Association, IDA. Then what is FDA? US-based Food and Drug Administration. Okay. So ISO. So what is ISO? I want at least one of you to expand what ISO is. Okay. Obviously, it is FDO. It should have been FDI, Federation Dentaire International. So FDO, there could be it could be an abbreviation to something, but I'm not sure it is. That something is related to our profession. In our profession, we deal with this numbering system. FDI, Federation Dentaire International, as mentioned in Wheeler. FDO is right answer. But what is ISO? Because I have some interesting information to present to all of you. What's ISO? What does ISO stand for? ISO, is it International Standards Organization? Are you sure? No, it's not objectives. Okay. ISO is not International Standards Organization. ISO is International Organization for Standardization. So why this confusion? Why this jumbling? I'll give you some history as given in ISO website. So it's all in the name, because International Organization for Standardization would have different acronyms in different languages, like IOS in English, OIN in French for Organization International de Normalization. Our founders have decided to give it the short form ISO, because ISO is derived from Greek isos or ISOS, which means equal. Whatever the country, whatever the language, we are always ISO. Organization for Standardization. Okay, something interesting to know and find out. Good. Excellent. Excellent, Ananya, Shreya, Juhi. Very good. Now, the second question. What are the ADA specification numbers for amalgam alloy and mercury? Headphones, I think this audio is suffice. If you have issue with audio, please let me know. Okay, I'll just keep a tab on the comments. So what are the ADA specification numbers for amalgam alloy and mercury? 1 and 7 respectively, 6 and 2 respectively, 1 and 6 respectively, 6 and 1 respectively. So which one do you think is the more appropriate option or answer? And also please give me a feedback as to which audio is better. The one which is being streamed prior, or the one which I'm speaking as of now. So which audio is better? Okay, you guys are busy in answering the questions. I assume it's all fine and perfectly audible.
Okay, so American Dental Association, they've given these specification numbers for all dental materials available. Now it's better. Thank you. So the ADA specification numbers for amalgam alloy, it's 1, as all of you rightly mentioned, and for mercury it is 6. Okay, it's amalgam alloy. Okay, it's not actually amalgam. The ADA specification number for amalgam alloy is 1, and for mercury it is 6. Yeah, now it's better. So using technology is actually not enhancing the audio output proportionately, unfortunately. Very good. Now let's move on to our next question. Which of the following can be used as a substitute for varnish? You know the functions of varnish, the purpose of varnish. So which of the following can be used as a substitute for varnish? Primer, bonding agent, flowable composite, petroleum jelly. So which one do you think is more appropriate answer? So in the meantime, I'll review some literature. You can answer in the meantime. In vitro studies suggest that varnish reduces infiltration of irritating fluids through marginal crevices and lessens pulpal irritation. So it's a pulp protecting agent. Clinical observations based on tooth sensitivity as reported by patients have yet to confirm these benefits in vivo. However, we continue using the same. Varnish is also claimed to prevent the penetration of corrosion products of amalgam into dental tubules, thereby reducing the unsightly tooth discoloration often associated with amalgam restorations, which is amalgam blues. However, high copper amalgam products, which are more corrosion resistant than their predecessors, have diminished the need for varnish. I want you to note down this particular point and consider this very, very important. A varnish is not indicated when adhesive materials such as GICs or bonding agents for resin-based composites are used because they rely on micromechanical retention. And dentin bonding agents have or serve the same purpose of varnish. So it is dentin bonding agents, as you guys have, as most of you guys have rightly answered. Okay, it is bonding agent, and consider these last 2 points which I've reviewed. It's very, very important. Okay. Very good. Now let's move on to our next question. The final question in round 2. What are the functions of a filler? Name any 2 functions. You can see in the process, I've given you the size of various filler particles in microns. You can make a note of it, or you can just take a screenshot or take a picture of the same. And what are the functions of fillers? So why do we have fillers? So if you review the literature which is given in fillers, before that, let me just go through the values given here. So you can see based on this size, we have classification of composites as well. Macro fillers, mid fillers, mini fillers, micro and nano fillers. Nano composites are quite popular these days. And also you can see the respective filler size particles. So name any 2 functions of a filler. So fillers, they can be used for reinforcement, strength. They modify viscosity, they increase viscosity with greater amount. So fillers are nothing but inorganic glass and or organic resin particles that are dispersed in a resin matrix to increase rigidity, strength, wear resistant, decrease thermal expansion due to water resorption, and reduce polymerization shrinkage. So if at all there is a question like all of the following are functions of filler except, so you should be able to answer. Or which of the following is not a function of filler, or which of the following is or are functions of fillers. Okay, so consider this again a very, very important, including the classification based on the size and their ranges. Fine, very good. Now third question, third round general questions. I'm sure you'll be able to answer all of them because nowadays each and every one of us is or following social media or in general news comparatively to a greater extent than previous generation. So we have smartphones. So does it mean we're smart? Let's try to find out. So what does, the first question, what does E represent in the following image? I'm sure you might have seen this symbol on top right corner of your mobile, right? So what does E stand for? Obviously it represents some kind of signal. So what does E stand for? Just now we were talking about smartphones, so I'm sure you're smart enough to answer this question. Okay. E for internet, E for Ethernet, or E for edge? Yes. So one of you rightly mentioned. It's not 2G network. It's between 2G and 3G. Okay. So enhanced data rates for GSM evolution, EDGE, Edge, enhanced data rates for GSM evolution. It's also called as enhanced GPRS. This technology lies between 2G and 3G technology, right? Okay. At least I'm sure you guys are familiar with this now. So next time, if you come across this, I'm sure you have clarity on what E stands for. Edge. So enhanced data rates for GSM evolution. Very good. Now let's move on to our second question. Why are primary dentition referred to as a milk teeth? So it's a general question, at the same time something which is very relevant for not just dentists but the entire population. So why are primary dentition referred to as milk teeth? Is it because babies drink milk often, or is it because of something else? Okay, I don't want to answer before you guys do. So why are primary dentition or initial dentition or first dentition in humans referred to as milk teeth? Exactly. So it has something to do with refractive index. So refractive index of milk is in the range of 1.344 to 1.3485. So it's around 1.3. So the refractive index is almost similar to that of milk. They appear milky white, right? The reason why only primary dentition are referred to as milk teeth, but not permanent dentition for the obvious reason. So the refractive index exactly is similar. Very good. Now let's move on to our final question. It's going to be a challenge to each and every one of you. And the irony is you cannot Google it. Okay. So that's a different question, but please answer this question prior. So name the only country that is also a continent. So you have world map in front of you. So check out the entire world map and see the only country that is also a continent. I'm sure you know the number of continents, the number of oceans, right? Which of the following? Okay, which of the following is the only country that's also a continent? India, because they say India is a subcontinent, but it's not a continent, right? It's a subcontinent. So please don't answer India. It's a subcontinent, agreed. But name the only country that is also a continent. Excellent. So as you can see, bottom right, you have Australia, which is also considered as an island country, right? Okay. So, you know, island is a piece of land, a chunk of land surrounded by water on all sides, peninsula, 3 sides. And what is a delta? So please find out what a delta is, because we deal with apical delta in endodontics as well, in root canals. What is a delta? DELTA. Very good. So the answer to this question is Australia. Now, coming to the next question, the funnier part is you cannot Google it, right? Because it's an image-based question. Identify the personality. The final question. Identify the personality. You cannot Google it. Or can you? Did Google come up with that technology where if you post an image, it gives you the answers? I haven't tried till date. So if the answer is yes, please let me know, because I need to find out information about a lot many images. Yeah, what do you call that piece of land which is surrounded by only water on 2 sides? I have no idea. Gerlin, please let me know. I would love to learn. Because all I learned is about an island and peninsula. That's it. And a delta, of course. So identify this gentleman. You have Google Lens? Yes, I heard of Google Lens, but I've never tried it. Okay. Yeah, I heard of it. Sundar Pichai explaining about Google Lens, but I'm not sure if Google Lens works for this. But anyways, one of you can try and let me know. Yeah, so you're all like the latest generation, so you know more about Google Lens than me. So identify this personality. So I'll give you some interesting information, or let me give you a hint. It is one of the, this person has a name which is similar to that of a resin that's most commonly used in dentistry. A resin is named after him, and it is one of the resins which is most commonly used in dentistry. And that resin is bis GMA. So identify this personality. I've given you the answer, now I asked you a question, that's it. So this person is or has a name which is similar, or which a resin has a name which has been named after this personality, and it is one of the most commonly used resin, and it is chemically bis GMA, bisphenol glyceryl dimethacrylate. So identify this personality. Bowen, Dr. Bowen. So Bowen developed bis GMA, bisphenol glyceryl dimethacrylate, a methacrylate monomer used in most modern composite resin restorative materials. He patented it in 1962, some 40, almost 60 years ago, around 60 years ago, and it has been the most used resin in dental restorations for more than 50 years. What a contribution, right? Inspiring contribution. Dr. Bowen, hats off and thank you. And so I would like to conclude with this particular presentation. I hope you enjoyed the presentation. I hope you enjoyed the quiz, answering all the questions, and also I hope you learned something in the process of this entire presentation. Exactly. Raphael Ray Bowen. Okay. Thank you, Vipul. Okay, guys, so this is what I wanted to highlight, and I hope you had some fun, and I hope this extrinsic way of presentation alleviated your stress levels by at least 0.0001%, which means most of it will be under our control. But if you're looking for external validation or extrinsic factors, it's going to be very ineffective. Okay, and also one of the I don't know, one of the YouTubers were actually posting a comment. They said that why are you looking at notes while you're teaching? Being a teacher, can't you just say without seeing? So I just got a comment along those lines a few days ago, and this is to answer to each and every one of you that I am a teacher. I'm here to teach based on my passion, and I have nothing to do with this external validation. Frankly speaking, I stopped looking for likes, comments, views, and external praise. So because when you turn inwards, the beauty of turning inwards is you're least bothered about what others say. And by the way, to that comment, I replied by saying that I appreciate your feedback, best wishes and love. So no matter what others say, if you know what you're doing and why you're doing, it's okay, as long as you have clarity on the same. And regarding the particular comment, I wanted to highlight this. I have this habit of having notes for all my sessions because I don't want to go wrong. And also, and most importantly, I don't need external validation, and I don't need to prove myself to others, because first and foremost, I'm special like you guys. We are all special in our own way. And secondly, I think I've already proved myself. And the stats which we have on YouTube and to our courses is a proof for the same, right? So as they say, these statistics or opinions are stupid, but numbers or facts are sacred. So I believe in the same. So anyways, this is just to give some clarity to those who assume that I'm just looking into notes while I'm trying to teach something. I'm here not to tell, I'm here to teach. I'm here not to tell, I'm here to guide. And whatever I've been doing, it's purely out of my passion. There is no force, there is no compulsion. And if you think otherwise, it's okay. Okay, right. So I really appreciate all your active participation, guys. And I hope this session is informative, as I mentioned prior. And if you're looking for notes, I suggest you to maintain customized notes, because this notes is something which I haven't derived it from someone else. I've prepared this notes, customized it based on my requirements for this particular session. So always rely on your own notes and do not blindly follow the information which is given in third-party websites, including all the all the various Google searches. Or you said you're talking about lens and all. I don't want you to rely on Google searches. Rather, rely on information given in various PubMed indexed articles, standard references, textbooks, and I can assure you that almost 99% or more than 99% of our courses in the form of e-classes, test series, discussions, assignments are based on standard references. And as a mini example, the session which we have conducted now, the information which I have given now is purely based on the information given in various standard references, including Wheeler's, Sturtevant's, ISO websites, all official websites wherever possible and necessary. And my suggestion to each and every one of you is, if you're feeling stressful, it's only because you are probably looking for external validation in the form of praise, in the form of likes, comments, or whatever it is. Or, you want someone to say that you're doing a good job. But it's okay even if others don't say, because you should ask yourself these questions. Am I doing good things? Am I here giving my best? Or am I doing things based on or in line with my passion? So if you have answers to those questions, if you have clarity in what you're doing, it doesn't matter what others say. People are really mean on internet, but that's fine. They don't have this, they don't have this courage to face the camera and speak. I mean, if it is offline, if it is one-to-one interaction, no one really has that, courage to actually speak such words. But this anonymity, hiding behind the cameras, people speak nonsensical things, you have nothing to worry about. Okay. So all I would suggest to you is not to look for external validation, even though it's tempting, even though it gives you goosebumps, but that's all short-lived. That's all very, very short-lived. And that's the reason why, even personally, I stopped following social media to a greater extent personally. I removed all my apps on mobile, and I'm using it only for sake of providing information which is relevant or in line with what I've been doing for the past several years. So please don't look for external validation. If someone praises you, it's okay. If someone criticizes you, it's okay, as long as you have clarity in what you are doing. Okay, so you're feeling stressful, mostly I think it's because you're looking, or it could be because of fear of criticism, or it could be because of expectations others have laid out on you. It could be including your parents. But please ask yourself these questions like, why are you preparing? Are you preparing for your own progress, or are you preparing to impress someone? If it is the later context, then please stop preparing. I'm telling you very frankly, don't prepare for sake of others. Not worth it. Not worth it. Please do it for yourself, for your own sake, for your own progress. Because you should realize the fact that this preparation phase is not a punishment, rather it's an opportunity for each and every one of you to progress, so that you can utilize the information which you have garnered over this preparation phase for your post-graduation, and not just for your post-graduation, but for the rest of your professional career. So you're laying a stronger foundation, and this preparation phase is an opportunity. And if you're looking at it in an otherwise manner, or if you're looking at it as a form of punishment, or if you're looking at it as a means to impress someone, or because of fear of criticism, there's no point in doing it, right? So please look into the bigger picture and keep asking yourself these questions. I'm sure you'll get more clarity. And most importantly, practically speaking, all of these answers which you give to yourself to all these questions will remove all the stress you have been facing, right? Take note. Okay, so with this, let's conclude our session, and I wish you all the best and loads of love. And for any further queries or clarification, please get back through mail at proudtobedentist@gmail.com, and please give me at least 24 to 48 hours to address all your queries or concerns. It's my sincere request. And take care. Have a good night.